us, and she is in Florida dealing with our little visitor, the hurricane. So we're going to go ahead and go through her slides. We do not have the same disease, but it still is going to pertain, so we'll let you deal with some of the different things that we're going to deal with. What we're going to talk about is how you as a patient or a caregiver can manage and maintain control over your medical team. We're going to talk about record keeping, and then afterwards we're going to talk, and maybe you can tell us how you handle yours, and maybe we can come up with some best practices. Who's on your team? I have dermatomyositis. I have a rheumatoid doctor, I have a cardiologist, I have a neurologist, and a general practitioner. Your disease, you may have a lot more. Some other things that you can consider when to be on your team is your spouse, your significant other, or a nurse practitioner, a PA. And a lot of times when you have your nurse practitioner or a PA, they might give you a little more time, might be more receptive to talking about like things you found on the internet or something like that. So that's who's on your team. You may know some others. There are special specialists, and John Hopkins and the Mayo Clinic are both special specialists. If you happen to have a university around you, they generally have some specialists. In South Florida, we have the University of South Florida that has some really good specialists in myositis. So if you don't have someone and you need to do more research, these are 3 places that you can go look and find more support. How to control your doctor's appointment and how to coordinate it with all of your professionals. Probably there isn't anybody in here that doesn't have lots of doctors. Nobody just has one. You have lots, and you have to coordinate it. You have to keep records. They're going to ask you questions. You've probably been on lots of different kinds of medication. So how are you going to keep track of all that? First of all, your doctor's appointment. You need to go into your doctor's appointment. You need to be prepared. You need to have your records. You need to know what your current situation is, what your medication is, how you're feeling, what you need to know from him. You can also take a buddy with you or significant other, but it's very important to set some ground rules before you do that. And the ground rules would be like, who's going to talk and when? Who's going to take notes? What if the doctor talks to you but instead of you? What about HIPAA laws? And sometimes this can be difficult, but you've got to be flexible with this. Sometimes this buddy is a family member, a spouse, a niece, you know, a lot of different things, a child. So you just have to establish the rules before you go in. When you're in the doctor, you've got 13 to 16 minutes of the doctor's time. You don't want to waste any of it. You want to come in there prepared. You want to know what questions you've got for the doctor, and you don't really just want to chit-chat. You don't want your buddy visiting. You want to get down to business and find out exactly what you need to know. So have your questions, however it works for you. Write them down, whatever works for you. Talk to your buddy about it, however it is, so that you're prepared when you get in. This happens to be Mary Ann's current situation. Mary Ann has had polymyositis since 1999. She keeps records that are amazing. It's important to know what medications you have, if you see changes when you take this medication, when you started taking them, your dosage. These are all the kind of things. She's talking about her CKs, which I don't know if everybody deals with that in your blood work. I'm not really sure. Yes?
No, that's, yes.
Yes, you do. And maybe, I know we do with dermatomyositis and we do with polymyositis, but, and you said with IBM you do too. So pretty much all of us do that. So it's very important. She's also had some issues with some skin cancer, so she wants to know about exercise on that too. So when you get into the doctor, she wants to know, what are the side effects of your medication? You want to know that too. So keep track of when you start taking something, how you react to it. She happens to be on IVIG, which also I've been on for dermatomyositis. I don't think you have it with IBM. Anybody else been on IVIG? Okay. Have you had any side effects from it?
I've only had one.
You've only had one. Has it helped you?
I think the headache.
Headaches. They will ask you while you're going, while you're taking it, they'll ask you if you're getting a headache, and if you're not, they'll up it and go a little bit faster. If you lie and say, no problem, then you get this massive headache and you never lie to them again. because you do get massive headaches if you go too fast. Okay, after you leave the doctor's appointment, it's a very good idea to review the notes. A lot of them have patient portals that you can go and visit. You've got to understand what happened at that visit. You may have a lot of information in your head. Write it down, take it home, keep track of it, and it's a good time. If you have your buddy with you, maybe you guys can discuss it too, and that can help you. And yes.
So the doctor's notes you can access through a portal?
Yes, well, it depends on your doctor. With our doctors, yes, you can. We happen to do some of the same doctors, and they're in a Pinnacle group, and they have a patient portal where we can see all of our blood work, doctor notes, and everybody can see everything. So it's really helpful when you have that. Do you have a portal for your doctor?
I think there is, yes.
You might want to find out.
Yeah.
Yes.
Well, sometimes you have the notes, and then you have the notes.
I know.
You can go to medical records and sometimes get those notes.
Yeah, and that's always so much more of the hassle, because you have to call in, and then sometimes they want you to put in a special form to a special part of the hospital.
Well, and you can ask them if this is available in the portal. You can also say, could I have a copy of my records today? Could I have a copy of your notes today? And generally the nurse or somebody will give it to you. And they're generally pretty receptive to doing that.
Yeah, that's the biggest problem I find though, because I've got, 4 or 5 doctors, they all have portals, I'm all on them, but to get what transpired today, no.
That's what
And it is a challenge, especially when you're going in a lot of different directions, you have different doctors, you're absolutely right, it is a problem, but that's where unfortunately you have to take care of keeping the records and knowing what's going on and getting them to share with the other doctors, which can be challenging.
That's even worse.
Well, what do you have, DM?
DM,
yeah. Yes, I do understand that, and sometimes they don't talk, and a lot of times they don't agree, which is one of our other appointments, but
If one doctor gives you a medication.
you can also do what? What'd you say?
I was saying, then you run into the problem is one doctor gives you a medication, and you go to the next appointment, and she says to you, why in the world are you taking this? Well, because
And then I think everybody has that problem, unfortunately. I actually had an incident where I was seeing a dermatologist, and everybody else was in the Pinnacle group, my rheumatologist and my neurologist, and they disagreed on something. And he said, you have to make a choice, Linda. What do you want to do? If you want to go in the direction of the dermatologist, then we can't help you. That's not the direction. And they wanted me to go on IVIG, and the dermatologist did not. I fortunately went with the IVIG, and it did put me in remission. So sometimes it's a good thing to listen to the one that gives you the good gut feeling.
Why would a dermatologist be against IVIG?
The dermatologist wanted to treat the skin, wanted
Right.
to treat the
Instead of the
surface,
disease.
and the rheumatologist and the neurologist wanted to treat the root of the problem. And they didn't agree on what that was.
Got it.
And sometimes they don't.
Yeah. And sometimes you don't want to see your records because they're very honest. Morbidly obese old woman.
Yeah.
And that's exactly how they
That's
say
how
it.
they say it, right.
Yeah.
Well, and sometimes they put PETA on there, if any of you know what that means.
Say what?
PETA. Pain in the.
Oh, that's good to know.
If you see PETA on your records,
Then you know, okay.
and please don't record that. But, okay, now let's talk about how you're going to keep your records. Like I say, Mary Ann's been doing this for a long, long time, and I did actually put it on an Excel spreadsheet for her, but she still pretty much handwrites everything. And this is what hers looks like. I'm going to pass it around. This is hers.
tracking something.
I actually put it on an Excel spreadsheet for her, and it did it so that you'd have to overlay it, because not everything she has is the same denomination, so it was challenged, but she still writes everything down. Whatever works for you is the right way. If that chart works best for you, then that is the best
I'm
way.
assuming she's tracking something there.
You'll see when you go by, she tracks all of her medication and her blood work, and she tracks everything. Well, she even tracks, like, you want to track your expenses. You want to know what you're spending on these things. You want to know what medication you're taking. You want to track everything. She happens to do things on a 3-ring binder. which you can color code, you can do your medication, your billing, your doctors, you can do all that. Whatever works for you, you can actually do.
Is
Yes.
she doing a clinic, or, which is a team, or is she doing disparate doctors?
She goes to the same pinnacle group of doctors that I do.
Like
They're private practice, but they're all in the same group, so same computer system. So everybody's records go into one. But then again, when she started doing this, portals didn't even exist in 1999.
At the university settings, are they a true clinic where they work as a team, or is that, do I have a false impression on what?
They
The
do
Mayos and
at some, and there's one of the doctors here from USF that works with us, and some of them that way. She happens to be wonderful. What we do at our KIT meetings, and we have KIT, which is keep in touch. I don't know how many of you have meetings, but what we do at our meetings is we pass around, if you've got a doctor that's really good and worked real well with you, we put that down on a list and we share that with our group. If you met with somebody that didn't really help you, that wouldn't listen to you, we put that down, because that's not something, you want to work with somebody that's going to work with you. So, how many people are in a KIT here? I know Joe's in my KIT. Okay.
Yeah, I live in LA, but I come down from San Diego
Okay.
because they don't have one.
It's been a lifesaver to a lot of us. All right. So, let's see, you can see what she's doing there. Let me see. Yes. A lot of people do things, let's see. It's not a bad idea. Hi, come on in. Not a bad idea to keep all of your records in this kind of book. Share it with somebody, review it before you go in. Every time a new challenge comes up, she keeps her records with her. If you have to go to the ER, if you have a hurricane coming down on you, it's a good idea to have your records in one place so you can take them with you, know what medications you are, what dosages you are. So it's a good idea to do that. And as we all just talked about, what do you do when your doctors don't talk? What do you do when your doctors don't agree? And what do? You have to make a decision. Which one am I going to go? And it's a good idea to ask them what research, what website they believe, because there's a lot of information. And as you know, we can prove or disapprove anything on the internet. So you've got to find information. WebMD, Mayo Clinic, Johns Hopkins, their websites are the best information in my opinion. You go get any of those, they do a lot of research, there's a lot of clinical studies out there. Has anybody taken part in a clinical study? Nobody? Okay. Unfortunately, most of the studies are for DM or PM. There's not as many for IBM. There's just not so much research being done. And again, you're going to have to decide. Sometimes you might have to make a tough decision, like I had to choose not to go with my dermatologist. I liked her. She gave me her personal cell phone number, said call me anytime, but I wasn't getting better with cream on my rash. I needed something to happen. And you know, IVIG scared the dickens out of me, but it was the right decision for me.
How long, question, how long have you had, which myositis?
I have dermatomyositis.
Okay.
I got a flu shot October 14, 2010, and got sick almost immediately. It took me 6 months to get diagnosed. I went to the Mayo Clinic, and it took about a year before they put me on IVIG.
Okay.
And I was on 2 series of IVIG. The first one was about 6 months, then I was off for a year, and then another 6 months. Yes.
Was the flu shot associated with
Yes,
it?
flu shots.
Tell us about that, I'm curious.
Well, what they believe is I have a super immune system, so I never really got sick. When I got the flu shot and it was absorbed into my blood and my muscle, my immune system looked at it as a foreign body and started attacking itself.
Was that the first time you had a flu shot?
Yes, yes.
Was it a live virus?
They believe it was a preservative.
Oh,
They believe it was, and this has not been proven. A lot of people have said something, and basically we had another lady in our kit that her dermatomyositis was dormant for 20 years. And then she went and got some little touch-up stuff. And when she did, she came active again.
I have dermatomyositis. I was diagnosed in 1999, and I believe that mine had a trigger.
Yeah.
And it just,
Right, it doesn't cause it, it's a trigger. You're exactly right. It doesn't cause it, but something triggers it. It was probably there all along, but something triggered it. Yes.
How quickly after, just out of curiosity, the vaccine, did you notice symptoms? Because I had a vaccine for like hepatitis. And it was just a
the
couple
next-
months before I started.
The next day, I was
Oh,
tired.
yours was.
And it was just, and that's all it was, I was just tired, and I'm like, man, I must be coming down with something, I'm really tired. And then I got a rash on my back, and they kept sending me to different dermatologists, and they told me that I had serum sickness from the flu shot, and then they told me I had sun poisoning. And I'm like, I've been out of bed for months, there's no way I had sun poisoning. And then another one told me I had a parasite, that you could only get from South America, and I hadn't known. And my daughter took me to the Mayo Clinic, and I was diagnosed immediately, within 5 minutes.
So you would never get another flu shot again?
I can never get any kind of flu shot ever again. And it is so rare that it happens, though, they don't even have to warn you about it. It's very, very rare that it would happen. Yes?
Mine was well, they now think I had juvenile, but mine was triggered by taking statins
Yeah.
for cholesterol.
Yeah.
And they just kept switching me to another statin. And then by the time I couldn't walk or get out of bed and I was covered with rashes, I thought, well, maybe it's something. Maybe that's something.
And unfortunately, our disease is not a common disease. So, and there's a lot of misinformation. My general practitioner, that I see right now, he's only seen one case of dermatomyositis ever. And that was in his residency, and he's from India. And he said they didn't know what it was until after the man died, and they didn't. And that's when they found out what he had. And that's the only time he's seen it.
Yeah.
Do you have a question?
Well, the statement, my rheumatologist said too, that it was triggered by the flu shot. And that was poo-pooed by the board of directors here.
Yeah.
And she had said, no more flu shots, no vaccines of any kind, and no anesthesia also. So now you need surgery, you're in trouble. But now last year, they changed their mind. The board of directors here says to take a flu shot. So I have had a flu shot and a pneumonia shot this year, first time in 10.
I will never do it again, and I did have a root canal, so I did have anesthesia, and it didn't seem to bother me. Like I say, I've been in remission now for 5 years.
But it's such an individual disease, you know?
Exactly.
Um,
If everyone in here had DM, we'd all have a different story to tell.
Right.
And
I had a flare-up when I had contrast, maybe, and then I had a pneumonia booster shot and big flare-up.
does the sun bother you? Does
You
the
know,
sun
I try
trigger
to
you?
stay out of the sun, and then I have the sleeves, yeah, I try to stay out of, try,
And they recommend that we stay out of it.
yeah.
I mean, they do that, but yeah. Anybody have any other suggestions on what you would do when your doctors don't agree? I'd say the best thing to do is probably find different, decide which one you want to go with.
And you really, it's like being a general contractor, you just have to
Yeah.
work with the subs.
Yeah, you're right.
Well, and that's why it's a good idea, like our KIT group, we know which doctors are good. And when I first got it, my 2 doctors, they weren't familiar with it, and they were almost excited, like a new disease, let me find out about it, and it was kind of nice. People were fighting to make me better.
I mean,
Yes,
sometimes it's not so much, it's not that they don't disagree. My rheumatologist, neurologist, and dermatologist are all fine.
Yeah.
But it's still impossible to get them to speak to each other.
yes, it is sometimes impossible to do that. And we also go through a lot of different, somebody was talking about medication, this one gave me this medication, this one comes over here and tells me this, and then where do you decide, where's the right thing? And you go through a progression. Generally, IVIG is the end of the last thing they try, because it's not a treatment for any of our myositis. And most of the treatments that I had were not for myositis. They were for malaria, or for asthma, or other things. Because there's no book, there's no plan for this is how you handle myositis. So, yes?
I had a dermatologist who was good, but I took him off my team because I heard him recording my visit, and he described it as end stage. dermatomyositis. And,
What?
and,
End
stage.
like you're the last.
and I thought, he's gone.
Yeah. And you
If
gotta do
he's-
that.
If he's written me off intellectually,
Yeah, yeah.
then I need someone else.
And there are lots and lots of good doctors out there. And another thing that they say, you know, let them know. When your doctor's doing really well, when your nurse is really helping you out, and somebody's doing the research, let them know. Thank them, thank them. They need to know.
That depends on where you live. If you live in a small community where there's only really one doctor, how do you go to another doctor?
You're not gonna be able to do it in, where do you live?
In New Mexico?
Okay. And I don't know about other places. I live in a very populated area
Yeah.
with lots of universities around and lots of good resources. And if you've only got one doctor, then other than going to a different town and doing the research on your own, but it's not like you can go to the doctor and say, look, you know what, I need IVIG. I need you to start me on this. You know, it's not gonna happen.
No.
He can't do that. He's got, and then another challenge can be your insurance, where you're, you know, when they stopped my IVIG the first time, it was because insurance, and then my doctor had to jump through whatever hoops were necessary to get me back on it. Yes?
What's the practicality of having like a specialist to kind of see you periodically and lay out a plan, and then to go to a more local team of doctors to execute the plan essentially? Is that practical, doable?
It is practical. When I went to the Mayo Clinic, they told me who in my area would understand and would be good to work with. So if you can go to your own area, it's much better.
Right.
But you're back to the fact that the person who's going to implement it, will they trust, oh, I don't think what he said was right, I'm not going to.
And it can happen, but again, if you don't have any choices, most of us have choices. If my doctor said that, he wouldn't be my doctor anymore. If he's the only doctor in town, and I now have to drive 2 hours every time, and a lot of us know you go to the doctor sometimes 2 and 3 times a week. And you don't want to, especially, I don't know, does it snow where you are? I don't know, the weather, hurricanes, you know, you don't want to have to drive through that. So it can be very challenging. Are you very active with yours now, your disease?
Well, fortunately, I have, the doctor I have happens to be very good.
Good,
You
good.
know, but that's pure luck.
Yeah, yeah, it is, but then again, like you say, you've got to fire that doctor. If that doctor's not listening to you and doing what needs to be done, you need to let that doctor go and probably find another doctor.
Or sometimes they fire you.
And sometimes they do fire you.
I had a
But-
cardiologist that said, if you won't take this medication, I don't want to see you.
And if they don't want to work with you, then you don't want to work with them either.
That's
You
right.
really don't. Yes?
Do you have any recourse when a doctor writes something on your file that you disagree with?
Do what?
When a doctor writes something on your file that you don't agree with,
Negative.
do you have any recourse? Like, can you qualify? There's no way that you can qualify?
You know, honestly, I don't know. Does anyone know? I really honestly don't know that. I guess you might be able to go somewhere like the American Medical Association and
Have you-
pose that question.
Have you
Maybe
talked
the
to your
insurance company,
doctor
that's another
about
good
it?
idea.
Well, no, I have 2 doctors, a neurologist and a rheumatologist. And the neurologist did not agree with Cellcept because I'm anti-Jo1 positive. And he said, it's not effective when you're anti-Jo1 positive. Then went back to the rheumatologist and she said, I'm putting you on Cellcept. And I said, no, because I'm anti-Jo1 positive, and the neurologist said not to do it. So on my file, she just wrote, refused Cellcept. But I want to
Oh.
qualify it and say, because I'm anti-Jo1 positive and was told that it wasn't effective. But I don't know how I can qualify it.
Yeah, and I don't know, but that is probably a good suggestion to maybe go the avenue of your insurance company, because they might be able to help you with that. And again, insurance, mine's been wonderful. You know, my IVIG was $43,000 a treatment, and my insurance paid it. Didn't have to pay any out of pocket. Yes?
How many treatments did you get?
I started out, the first round, I just did it once a month. The second round, I started out, did it every day for 12 hours a day for the first 2 weeks. Then I did it once a week. Then I did it every 2 weeks and 3 weeks and 4 weeks, and then 6 weeks at the end. And you can do it at home now. A lot of the vendors out here provide it, and they will come to your home and do it. I personally was nervous, so I wanted to go to the hospital and do it. Mary Ann does hers at home,
Good.
but I just wasn't comfortable. It scared me. I was just, You know, so much stuff going on, I wanted to do it at the hospital.
So 12 hours a day?
I had it down pat, I took my laptop, I took movies, I took books, I took my food, I had to go to the bathroom, I'd unplug and go in there myself, and they were like, hey, you know.
Yeah.
So it was okay, and you get to know the nurses really well, and nurses, you all know, nurses are wonderful. Nurses can be just wonderful. Do what?
I can't imagine, I thought 6 hours was bad, so I can't imagine.
The first time it was 6 hours, when they had me come back the second round, it was 2 bottles at first, and they brought in
Wow, that's
8 bottles, and I'm like, oh, that's not mine. That's not mine. And they said, no, that's yours. But it really worked. It knocked it out of me, and I haven't had any medication at all for 5 years. This is what she carries with her. All of her different medicines that she's on and her dosage and the supplies, which right now she's probably delighted to have it with the hurricane coming.
Yeah.
You know, before I left, I knew a hurricane was coming. I took all my medication and put it in a Ziploc bag and thought, well, that'll say that if, you know, a flood comes, I'll be fine. But I may not even have a condo when I come back, who knows? And that's just some other records of her medication and over the counter, just that she keeps with her, and then she has the schedule when she takes it. Most of you probably have a little thing that you carry with you that has all of your pills in there. And this presentation will be on their website if you want to get a copy of it. She also suggests a log file, and like I said, she's been doing this since 1999. So she keeps track of everything. She knows probably her blood work and her labs more than any of us ever will, because she studies them, she understands what she's doing, she knows where her CK should be, she knows all of that. And Krager, he's a rheumatologist, and he is really good. We also do a lot of stuff where we invite doctors. May is Myositis Awareness Month, and we have like a dinner, and we invite the doctors, and they get their credits, their medical credits for coming and attending the dinner, and we talk. They come from USF and talk about myositis. Okay, and this is one of them I put on Excel for her, I believe. And this way she can sort, she can search, but she still wants that paper.
Yeah.
That's still what she needs. She's been doing it for almost 10 years. This is what makes her feel comfortable. And this is the same chart, just a little closer up, but you all got to see it firsthand. Okay, and what else do I need to record? That's very specific things like who you want to talk to, email addresses, the portal, name and password. You might want your husband or significant other to know how to get into that portal. If you're not doing well, he may need to know what you're doing. Office hours, insurance. Anybody think of anything else that you really need to record? Yes?
Maybe your diet.
You know, that's a good idea. We didn't touch on diet at all, but I think probably from these classes, you're all finding out diet plays a big part in especially inflammatory.
Well, because if you're keeping a diary, you could say the different things that how you're feeling that day, and then maybe what you're eating, what your medicines are. And then if you notice a trend, be like, well, every time I don't feel well, this is what I'm eating.
Yeah, exactly. That's a good idea. Yes?
You could record things that you're not supposed to do. For example, certain medications, you're not supposed to take broad spectrum antibiotics. And if you don't remind new doctors of that, and that can throw you into a whole cycle.
And that brings up another interesting point about you have to be really careful about what interactions you have. A lot of you have said, this doctor gives me this and this doctor gives me that. How do they talk?
Yeah.
Yes?
The other thing I would definitely include is if you've, names of anybody you've given your medical power of attorney to.
Yes. Yes. And that goes back to the HIPAA laws and when they're coming in, because it's better. I happen to be a widow, so most of the time I'm going through all this alone. But if you've got somebody that's an extra pair of ears, it's very helpful, very helpful. And if you keep it all down, then they know. No, you were supposed to go to a doctor. You haven't been. You were supposed to go every 6 months, and you haven't been yet.
Linda,
Yes.
I found that make sure that you only use one pharmacy and that you have a good relationship with your pharmacist, because they're going to pick up if somebody, 2 doctors have given you something that's not what your pharmacy will. If you ask, you know, is this okay? And
They're generally pretty good about it.
they're very
They
good,
generally
very
notice.
good, and I really appreciate my pharmacy.
Yeah.
they're really,
But you're absolutely right, if you go to the same pharmacy, then he's gonna know all your medications, and when you get something different, he's gonna be like, you sure you're supposed to be taking that, you wanna check with your doctor? And future planning, none of us wanna think about it, that, you know, it's probably a good idea to have your wills, your power of attorney, your medical power of attorney. You know, I'm a widow, so I had to think about who would be the best person to be that, and that person has to be my daughter. And your advance directive, and do all the doctors know? Your insurance, I happened to just retire in July, so I went from private insurance to Medicare, and it's, I'm learning some differences. I'm learning some differences.
Our sympathy.
Yeah. Well, so far so good, but I had really good, I work for the state of Florida, so I had really good insurance. And I don't think it's gonna be quite as good, but that's okay. Okay, now, why don't you guys tell me some of your best practices of record keeping, or maybe we can have some more ideas other than the paper. You were gonna tell us, you had something you were gonna add about how you handled it in yours, Joe?
oh, I just make sure that I keep a list of questions and go, before I go to the doctor. Anytime I have a question about anything, because I'm so blessed, I only go every 3 months. But anytime I have a question, I write it down, so when I just bombard him with all my questions. And then he goes from there.
That's perfect, that's perfect. Yes?
I was gonna say, I started a spreadsheet of my lab results, because a couple years back, I didn't realize that the CK test had fallen off of my, because every year it's like a lab, your standing order drops off, your doctor has to put a new one on, maybe the doctor's office has to put it all on. And after a period of time, I thought, I'm so tired all the time. And then, finally realized that my CK wasn't being, and then surprise, it was really high. And so ever since then, I track it, and that way, if something's not being tested, I immediately see a little blank in my spreadsheet of,
Well, she also brings up a very good point that you've got to be your own advocate. Nobody else is going to. You got to stay on top of it. You got to do the research. You got to be your own advocate. It's very yes.
Yeah, the thing I've observed is, I've got a really good primary care physician, who has a portal, but he's really good at sending me to specialists, the neurologists and the rheumatologists and what have you, who are not on the same portal. And one of the things that I've done is that my primary, I funnel everything to my primary care's records, and the portal gives me the ability to either write or copy in documents that I got scanned or gotten from the other doctor, and put it in his portal. So everything from all the various doctors I now have in the primary care portal, even though they didn't start there.
Well, and I know I just changed.
I tried to do that. You're a smarter man than I.
Well, I just changed. My primary care doctor went out of the Pinnacle group, and I wanted to stay with him. But he can still get into their portal. So sometimes they do allow some sharing. But again, you worry about getting all your records out there. None of us want that to happen. Did you have something else you would add?
No, I was going to agree with them. I mean, it would be great if the different groups would be able to, you just say, I want you to be able to get into this portal. But unfortunately, it's not to that point at the moment. And there is a mechanism, Lucy is what the name is, but I haven't figured out how to get records manually put into other systems.
It doesn't work. Lucy doesn't work very well.
Yeah.
Do I?
Lucy doesn't work very well.
Oh, Lucy doesn't work very well.
No, I wasn't.
think Epic is the one that Pinnacle uses.
It is Epic.
Do I?
It is Epic, Lucy. It's like supposed to
It's
be
Epic, my chart, I think.
There's my chart and Epic, and there's so many.
It works really well. I look at mine, I have my labs done. I'm in remission, but I go every 3 months and have blood work done. And as soon as I get it done, I go and look and make sure.
Some portals work great, others. Now, I was going to say on record keeping, much to my wife's dismay, I haul it to every.
Is this your wife?
Yeah. But, I've got all CDs in here, all hard copy records. Only because you never know what question's going to work.
And if it works for you, then it's the perfect system for you.
Tell her it's a great.
It's a great system. It's perfect.
All he needs is current.
Well, you know, and a lot of people are doing it, there are apps at the Google Store or
Yeah.
the what is it called? Apple Store. There are lots of applications that you can get down and track it. And you know, we've got the watches that can track all this stuff. There's a lot of different modern technology out there that we're not using, but you could. Any other input, questions? Yes?
So I missed the first part, and I
Okay.
apologize, but there are two things that I think can be really helpful for the encounter with the physician or clinician. And that is if you make your list, you're never gonna get through everything on your list.
You're right.
In fact, the physician is there going, okay, we got 10 minutes or 15 or a half hour, whatever, and there's a lot to do. And so what I suggest is make your list, but then say, these are the 3 things I don't want to leave here without discussing. Then email it to the physician a week ahead to say, I'm seeing you on such and such, I want you to know what my issues are.
That's a good idea.
And then give them and their nurse a hard copy, 1 page.
Yes.
Here are my top 3 issues, here are the other questions if we have time. If we can't get to them, how do I get them answered before our next?
That's a great idea.
It's really effective because it starts creating expectations. And if they say, we don't have time to go through all 3 questions, let's do 2 today, and let's do the other one on the phone, that's probably okay. The other thing is, everybody has some intimidation in physician clinic offices to some extent. And if you're one of those people, bring somebody who can watch and listen and be your advocate. And it may not be your spouse or partner, but another set of eyes to help you get your questions answered is really helpful.
Absolutely. Absolutely.
His comment presupposes that the doctor actually looks at something before he sees you. I'm
Exactly.
finding out
That's
that.
why you bring the
Yeah,
hard copy.
yeah.
Yeah, I mean, normally it's like, oh, what was, you know, his first question is, gee, what was your blood results? It's like, okay.
But you've got all this.
I can tell you that if
It
you
gets
email it
sent
to
to
them, if they give you their email,
Oh, I've got his
they will
his
look
portal
at
information.
They will-
It may be the PA doing it, it may be the
Doesn't
nurse,
matter.
but yeah, you generally, if you send them ahead of
They look at
time.
it.
And I haven't had that experience, I've had really, really good experience. My neurologist, actually, he'll spend up to an hour with you.
Yeah.
Most of the others are 15 minutes in and out.
You got it, yeah, in and
Yeah,
out.
but the neurologist, he spends about an hour with you. He doesn't see that many people. And if you go more than a year without seeing him, he drops you.
Yeah.
Yeah, and you're not gonna get back into it, so you make sure you make, and that's why I'm there, I see all the doctors once a year now, and then I do my blood work every 3 months.
Well, along that line, do you have an opinion of a neurologist versus a rheumatologist as far as being your lead person?
Well, actually, they had this little thing where they both wanted to be the lead, and they were like having this little competition about it, and the neurologist won.
So-
And I don't know why, I guess he just told Dr. Krager it's gonna be me, so,
Bigger personality.
yeah.
So,
And they were strong, so yes.
so I was gonna, can I respond to that?
Sure.
So are there any Mayo people here? Huh? So my wife has IBM, and we live near Rochester, Minnesota, so she goes to Mayo. And she has seen both the rheumatologists and the neurologists there. They view these diseases differently, they treat them differently, and they don't talk to each other very often, because they come at it different from the philosophy. So when you ask the question about one or the other, I personally think getting the perspective of both at some point is really helpful. They view the situation, the rheumatologists think it's more, at least with IBM, more of an immunologic, inflammatory process, and the neurologists think it's more of a degenerative process, and they treat it differently.
I think with mine, the neurologist was the one that wanted to do the research.
Well, the reason I asked the question is that I'm moderately happy with my rheumatologist, but I certainly wish that he would take more of a big picture look and look at all the, because the data that was taken by the neurologist, the data that was taken by the pulmonologist, he just doesn't look at it. He's looking at CPK numbers and
That's what he knows.
pills.
Yeah, and my GP is very nice, I like him, but he has no clue. He has no clue. He relies upon what everybody else says, And, you know, my rheumatologist will say, now make sure that he puts this on every blood work. I'm like, okay. And I say, now don't forget, Dr. Krager, once you put that on there, and he does. But my neurologist is the one that got me on IVIG. And he's the one that fought with the insurance company to get them to approve it a second time, so he's my hero. Any other suggestions or input?
Well, I wouldn't put all the doctors, all the same neurologists, you know, into one package and all the rheumatologists. To me, they're individual doctors, and they have different opinions.
You're absolutely right. You're absolutely right. And like, if you're in a small town where you don't have all these different options, and I actually had a great experience with the Mayo Clinic. I had been sick for about 6 months, and I went up there, and they said, here. They sent me to rheumatology, neurology, dermatology, you know, did my blood work, did my, you know, MRIs, all this kind of stuff. And it's like, bam. And 2 hours later, everything was done, and they had the results of everything. So
2 hours later, what?
Do what?
What was your 2 hours later what?
They had the results of my blood work,
Oh,
my
okay.
diagnosis, everything. Told me who I needed to see in Bradenton. I went to the one in Jacksonville. I was totally blown away from Mayo Clinic. I can't say enough.
It's a different model.
It was great. My experience was wonderful. Yes,
Did your insurance cover it, or do you pay?
it covered every penny of it. I have really, my disease hasn't cost me anything at all, other than prescriptions. But like my IVIG didn't, but I was on 17 different medications before we led on to IVIG because it wasn't working. They try it for a couple weeks, it's not working, they try something else and something else and something else.
So did you have to get a prior authorization to go to the Mayo?
No.
No, really?
Government in state of Florida, great
Yeah.
place to work, great insurance.
Yeah.
PPO. PPO? Yeah, no. Yeah. Whole different animal.
And I'm finding out with Medicare that I'm gonna have to get,
Yeah, everything.
but they're telling me Medicare approves IVIG, no problem, no question about it. I don't have to fight, and they cover it 100%, so. Yes?
I had a good experience too with the Mayo Clinic. I had a 1-day appointment and they kept me 8 days, you know, I saw everybody. It was great.
Yeah, it was great. I mean, I've never, my doctors are the same portal, but they're all in different buildings on different sides of town and different
Right.
staff that you go at the Mayo Clinic and, you know, those people are brilliant up there. The one in Jackson, did you go to Jacksonville?
No, in Scottsdale, Arizona.
Are there 3?
Yes,
Yeah.
and Mayo in Minneapolis.
When you went to the Mayo Clinic, maybe you too, did you have a true team of people work with you?
I didn't know I was going to. I told them what was going on, or my daughter did. She called and talked to them, said this is what's going on. They started out with the dermatology because I had a rash. And she sent me over to, and she said, I think you have dermatomyositis, but I want you to see our neurologist. I want you to do blood work. I want you to do a muscle biopsy. I want you to see neuro. And she sent me over and they took 9 vials of blood and sent me over here and they did an MRI.
All in the same day?
All the same day, within 2 hours.
See, that's not the experience I had when I went up to Johns Hopkins. You know, everybody, it's probably a center of excellence, but, you know, well, we can't get you into a dermatologist, they don't have an appointment. You know, we did a few tests that were reruns of tests that were already run, so not a very good experience.
And my daughter may have made arrangements ahead of time, I don't know. Yes?
I go to University of Texas,
Yeah.
and they work as a team. And so when I go in to see the myositis doctor, he refers me right away to the rheumatologist and the rheumatologist to the heart doctor, and then they all get
And they all
together.
talk.
It sounds like a great way to go.
And
Yeah. It is the best way to go, but,
Is Mayo Clinic a teaching facility?
Yes.
yes. Yes.
Some,
And
I've heard sometimes that the teaching universities are less coordinated, let's say.
They have their own medical schools.
Yeah.
And same thing with USF, and
Yeah.
they do a lot of research. When I first got dermatomyositis, they were trying, I think it was Columbia University was doing.
Well, he mentioned Johns Hopkins, and I mean, that's a huge teaching place.
Yeah.
I just wonder if that association is.
Actually, in their literature, they say we work as a team, But when we got there,
But what are they working on? They're working on research.
yeah, maybe.
They're not
And
working
there's a
on-
lot of research, and they,
If it's a research facility, it's a different game.
well, the blood that you gave today, what was that research for?
I have no idea.
And
They
UCI.
ask for
It's what?
That was for Irvine.
What are they
You
looking?
see, everybody is the best.
It, for IBM purposes, but they also wanted to have some DM,
Okay.
and I forget now. He told us at the session this
Weren't they looking
morning.
for an
Wasn't it for the
A1?
Did they get enough people?
Yeah, it was an
to-
antigen,
quite a few
one of
there.
the antibodies they were, wanted to verify.
Yes,
So one of the key questions to ask the specialist, whether it's a neurologist or rheumatologist, is how many of these cases have you seen or do you manage?
Yeah, the more-
Oh, yeah.
Because you're gonna, so many people go to places where I've seen 5 of them, as opposed to Hopkins or Mayo or something where they see hundreds. It's a very different milieu.
But the problem is when you get, you leave John Hopkins and now you get back to your neighborhood and you're looking at for a rheumatologist and what, you feel lucky to talk to somebody who has familiarity with dermatomyositis.
Yeah.
Yeah, no, and that's why you have to stay connected to the center, I'll call it Center of Excellence, I don't know. That's why you have to stay connected and get there periodically, but use your local resources in between. It's hard. That's what we've done.
mine's quite a ways away from me.
My
but-
wife goes to Mayo for
Yes, ma'am.
Does anybody have any experience with UC Irvine?
Other than giving blood?
Other than giving blood, right?
I went down there to see if I could qualify for,
Clinical studies.
clinical studies, and I had to get, pulled me off all my medication for 6 months, and then eliminated me because I was diabetic, and they knew that from the start. So, I was kind of upset because
Understandable.
I took some steps back by going on for the medication.
And we've had a few people in our kit that have taken part of clinical studies, and I've heard some really negative things and some really positive things.
Yeah.
So
About clinicals in general or Irvine clinical?
Well, it was Miami, the ones
Yeah.
that were bringing it up. but I
Yeah,
don't-
because I know I had some qualms, like, well, I might be getting a placebo.
Right.
And you're off your medication, and what's it going to do?
And, or the other thing was, well, I might get the drug, and wonder if it does well, and then at the end of the study, I have to go off of it. because I
Right.
won't get approved for another 2 or 3 years.
Right,
So
or
it's
the
like-
insurance won't cover it anyways.
Yeah, yeah, exactly.
Yeah.
Anything else? Anybody wants to share? Yes, ma'am.
I have all my Medicare card and my insurance and they're all cards. So what I did is I took them and transferred them to my records, so that they're all on one sheet, all the phone numbers, everything, because you have to put.
You just like print it out and give it to them?
And, God bless it.
Yeah. And that's another really good idea, and I say, these conferences are wonderful, and you're gonna learn something at every one of them, and as a presenter, I've learned something today. Yes, ma'am.
One thing that we do at our house is, our sheriff's department gave us a file for life that goes, a little thing that goes on my refrigerator, and I have all the information in it. And I kept my mother for a long time, and the last time that she had to go to the hospital, when I called 911, I just picked up that little piece of paper and gave it to the ambulance driver, and when I followed them to the hospital after they went faster first, they had all the information they needed, and they didn't ask me for anything.
I think that's
Because
important.
I mean, it had her birth date, it had her insurance information, her medications, her doctors, their phone numbers, everything was on it. And it just took it, and then one of the girls at the emergency room said, you need to be teaching a class on this.
We do become experts really quickly on whatever we need to, don't we?
We have the same thing on our fridge, and when
Yeah.
they come in, they can just look at the fridge and grab it. Another thing, what I wanna share, I don't know, I'd like some input, but my husband goes to hyperbaric chamber every day. He's gonna go for 40 days. He's been halfway there. It not only promotes the healing of wounds, but it promotes new cells in the body. And I was thinking, the cells, muscle cells in myositis, I was thinking, why shouldn't they try something like that, you know?
They may have, there's a couple classes that talk about different alternatives. There are a few people that are trying stem cell, but at this point, we don't know. And part of it could be the cost involved when it hasn't been proven at all. But I think there's a class, I think it's tomorrow morning, about different alternatives. And that might be a good question to ask them there.
It would be worth it for
Remember
a lot
to
of
do
the
your
IBM
evaluation.
people especially.
And thank you guys very much. Not a Mary Ann, but.
My name is Chris Harris. I have dermatomyositis. I was first diagnosed in 2005. So this is my 12th year, and this is my first year to this meeting, which I'm kicking myself for, but going forward, I'll be at every one. My favorite part of this meeting is meeting the patients and their advocates, and I'm amazed at the support that I've received since I've been here from everybody. And I love that people have shared their stories, no matter how challenging, but I love the idea of hope for everybody. And my second favorite part of this meeting is the individuals who have donated their time to move this disease forward and try to find a cure, which includes everybody with the Myositis Foundation as well as the panel. Every person who has volunteered their time, the physicians, the physical therapists, the volunteers, and the fact that they've committed to do this as they move forward is amazing to me. And I love it, and I will be here again next year and the year after that. And it just gives me a lot of hope when I was very depressed. So thank you for inviting us, thank you for supporting it, and I look forward to seeing everybody next year.